Thank you so much for giving me a moment of your time. My name is Carliza Canela, and I will be discussing the correlation between static and dynamic impedance during electroconvulsive therapy. ECT is decades old and is currently FDA cleared for the treatment of severe drug-resistant depression. It uses a high-intensity current to elicit a motor seizure in the patient. Electrode placement is a parameter predetermined by the clinician, and in these cases, we're speaking about right unilateral or bilateral. Pulse width is another parameter decided upon by the clinician, and it's either 0.3 milliseconds or ultra brief or 1.5 milliseconds or brief. The charge is determined by the initial titration session. Static impedance is the resistance of the head to the current at 1 milliamp. Dynamic impedance is the resistance of the head to the current at 800 or 900 milliamps. The relationship between individual static and dynamic impedance has not been established. However, we do know that dynamic impedance is significantly lower than static impedance, and that individual static and dynamic impedances change between people and for a person between sessions. We also know that there exists a weak relationship for charge and dynamic impedance and a weak direct relationship for age and charge. We wanted to see how all of these parameters related to one another, so we looked at the raw data of 90 patients from Sackheim et al. 2008. We divided these patients by montage and by pulse width, and we took the average of their impedances, so each point on these graphs is a single subject, and the error bars show the full range of their impedances for static and dynamic. As can be seen, there is a statistically significant relationship, sometimes moderate and sometimes much stronger, that exists for these two parameters. We also looked at the same relationship across stimulations and found that that relationship was still there. We also looked at the distribution of the static and dynamic impedances amongst different groups to see how they compared to one another, and found that the RUL montage had a higher impedance and the females had a higher impedance than males. We then looked at the other parameters and did not see anything that was nearly as robust as the relationship between static and dynamic impedance. We then wanted to see if this relationship would hold outside of this group of the 90 patients. And so we looked at Sackheim et al. 2009 and found that there was a statistically significant relationship between static and dynamic impedance that ranged all three centers, with the exception of the BL montage at Western Psychiatric Institute and Clinic. Taken in totality, this analysis suggests a robust relationship between static and dynamic impedance. It is unclear why this was not recognized earlier. Other parameters do not show an evident relationship in these data.